Okay.
Okay, you can start now.
So, good evening, all. Today's topic of discussion is Agni Karma. So, before I speak, let me know what is your idea on Agni Karma. Whether you have seen the procedure Agni Karma and what is your idea on that topic. Annapurna, can you hear me?
Yeah, ma'am.
Okay, so
Happy Doctor's Day, ma'am.
thank you. Same to you.
Thank you.
So, Agni Karma, whether the procedure is done in your college, whether you have seen the procedure, and what is your idea on the topic.
I'm not seen,
Have you
ma'am, but
seen any procedure? Okay.
not seen, ma'am, but read in previous
Hallelujah.
years, ma'am.
Okay, fine. Okay. So, Agni Karma is one among the most important parasurgical procedures mentioned in Ayurvedic literature, and it is still extensively used in surgical practice in modified form. So, can you tell me what is the modified form of Agni Karma which is used in the surgical practice? Which can be the modified form? In the modern practice, we correlate some procedure or some technique to Agni Karma. What can be that? Any idea? Agni Karma can be correlated to that electric heat cauterization. Okay, so in the modern practice, in the present period also, the same technique in the form of cauterization is extensively used now also. So when we consider the term Agni Karma, we know it has evolved from two words, Agni and Karma. Agni means fire and Karma means the procedure or the technique. So the word Agni Karma denotes the procedure which is done using Agni. Agnina Kritva Yat Karma or Agni Sambadha Va Yat Karma. So that which is related to Agni or that Karma which is done using Agni. That is understood by the term Agni Karma. So you know in Agni Karma there is therapeutic burning which is done with special tools according to the site of the disease or whatever it is. The therapeutic burning is done in that procedure. So Agni Karma has been given special place in Shalya Tantra by Acharya Sushruta. In the previous classes, we have seen about introduction to Shalya Tantra, we have seen about the Yantra, Shastra, etc. So if you remember, you know, in the definition of Shalya Tantra, there was mentioning of Agni Karma. Similarly, when we discussed about Yantras and Shastras, we have seen that this Agni Karma is included as one among the Upayantra as well as one among the Anushastra. And when we saw the definitions of Upayantra and Anushastra, we know it is not that much superior to Yantra or Shastra, but it is told like Upayantra is something that is Yantra Samipa Vartini, that is almost similar or near to the Yantra, and Anushastra is Shastra Sadrisha, something which is similar to Shastra. So, in that way, also, when we take, we can understand the importance of Agni Karma. And in addition to that, the approach of Agni Karma has been mentioned in the context of various diseases like Arshas Chikitsa, Bhagandara, then Gata Vata Vikaras like Sirasnayu, Asti Sandhigata Vata Vikaras, Gridrasi, etc. In the treatment part, we can see the application of Agni Karma. Okay, so now we will see about the references in the Samhita. Here I have taken Sushruta Samhita reference mainly, but I have included the Ashtanga, Hridaya and Sangraha references also, but I will be stressing on Sushruta Samhita. Okay. You have got the notes?
Yes, ma'am.
Okay, fine. So first shloka is about the Agni Karma Mahatva. And the shloka is Ksharadaknir Gariyan Kriyasu Vyakhyata Tad Dagdanam Roganam Apunarbhavat Bheshaja Shastrakshare Rasadhyanam Tat Sadhyatvacha. That is by Acharya Sushruta. And Acharya Vakpata also explains the same concept. Agni Kshara Davisreshta Tad Dagdanam Asambhavat Bheshaja Kshara Shastraisha Na Siddhana Prasadhana. So it is told here in this shloka, it is told that Agni Karma is considered superior to that of Kshara. Why it is compared to Kshara? Because this Agni Karma Vidhi Adhyaya is explained next to Kshara Karma Vidhi. Also, in the Kshara Karma Adhyaya, it is told Kshara Karma is the Pradhanatama among Bheshaja Shastra, means Yantra Shastra, all when we take. In that chapter, it is told like Kshara is the Pradhanatama Karma. So a comparison is done with Kshara and it is told Kshara Dagnir Gariyan Kriyasu. So when we take those two statements made in those two chapters, in the first chapter of Kshara Karma, it is told that Kshara is Pradhanatama. And in the next chapter, it is told Kshara Dagnir Gariyan. So to substantiate that, it is told that Kriyasu. So here in the commentary, it is told it is not about the guna. While explaining Kshara Karma, it is told about certain gunas, how it is acting, all those things. And there, how it is, how Kshara is Pradhanatama, that is explained. So here, in the commentary, it is mentioned that Kriyasu, that is in terms of karma, Agni Karma is considered superior than Kshara Karma, not in terms of guna. So we should not contradict that two statements. And it is told why. The reason is told in the same shloka. Tad Dagdanam Roganam Apunarbhavat. First reason is Tad Dagdanam. So here the treating by Agni Karma is by Dahana procedure. So the diseases which are treated by Agni Karma will not recur. Apunarbhavat. And the next reason is told is Bheshaja Shastrakshare Rasadhyana Tat Sadhyatvacha. All those diseases which are considered asadhya by the man, means by Bheshaja, Shastrakshara, all these, that diseases are considered as sadhya when treated by Agni Karma. Because of these two reasons, it is told that Agni Karma is superior to Kshara. Kshara is taken here because Kshara is already told as the Pradhanatama Karma. So if we consider the probable action of Agni Karma, it is like the Agni Karma is having, when we consider the disease as such, in certain conditions it is acting as a mode of treatment for relieving the pain. And next is directly on the disease as such. So two concepts are explained here. That is, due to the Ushna Lakhu Sara Guna of the Agni Karma, there will be Vata Shamana, which in turn will act as Vyathi Shamana. That is one concept wherein we can take the pain feature more. Next is when the Vyathi as such is taken, we know there is a concept that due to Dhatu Agni Mandya, the Vyathi is occurring. So here, due to this Agni Karma, due to the Ushna Guna of Agni Karma, it will act on the Dhatu Agni. Where the disease is caused by Dhatu Agni Mandya, this Ushna Guna of Agni Karma will act upon Dhatu Agni and it will cause Utkleshana of Dhatu Agni. This Utkleshana will help in the Ama Pachana and further it will act as Vyadhi Shamana. This is the probable mode of action of Agni Karma. Next is the classification. When we see the classification, there is no clear-cut description about the classification of Agni Karma in Ayurvedic literature. We cannot get the shlokas regarding the Bheda. But by the detailed description when we take, we can classify according to the concept. And based on that, the Agni Karma can be classified according to the dravyas used. According to the dravyas used, there will be two classifications. That is Sniktha Agni Karma and Ruksha Agni Karma. Sniktha Agni Karma, when the Agni Karma is performed by means of Sniktha dravyas like Madhu, Krida, Taila, etc. When these materials are used for Agni Karma, that comes under Sniktha Agni Karma. And Ruksha Agni Karma, when Agni Karma is performed by means of Ruksha substances like Pipali, Shara, Shalaka, etc. those kinds of ruksha substances are used for Agni Karma, then that comes under Ruksha Agni Karma. That is the first classification according to Dravyas used, Snigdha Agni Karma and Ruksha Agni Karma. Next is according to site. Site here means we know in further classes and all we will see when in Chikitsa, when we see some diseases, it is told like Agni Karma have to be done at the site of the disease. And in some cases, it is the location of Agni Karma is told somewhere else. Other than the site of the disease, somewhere else it is told about the application of Agni Karma. So based on that site of application, it is divided into two. Sthanika and Sthanantariya. Sthanika means local, that is at the site of the disease, like Arshas, Kadara, etc. At the site of the disease, we will be doing Agni Karma. So on that basis, it is Sthanika. And Sthanantariya means distal to the site of the disease, like in Vishujika, Apachi, Gridrasi, etc. The Agni Karma have to be done in other places other than the site of the disease. So that is the next classification based on the site. Sthanika and Sthanantariya. And next is according to Akriti. That you will see in detail. It's not 8, it is 7. 7 types according to Akriti. Then fourth classification is according to Dhatu. That is the level of application of Agni Karma. There are 4 types: Tvagdagda, Mamsadagda, Sirasnayudagda, and Sandhyastidagda. 4 types according to Dhatu on the or the level of application of Agni Karma. So thus the classification can be done based on dravyas used, based on the site of application, based on the akriti, means the shape, means the pattern in which the Agni Karma is done, and based on the dhatu, that is the location, the level of application of Agni Karma. So that is the classification. Next is the Dahanopakarana. Dahana Upakarana means the various accessories which are used to Karma. And the sloka is Adhema Bodanda Sharashalaka Jamba Oshti Itara Loha Kshaudra Guda Snehascha. That is by Acharya Sushruta. In Acharya Vakpada it is told Varti Godanta Surya Kanda Sharadibhi Madhu Sneha Jamba Oshta Gudadibhi. So these are the materials that can be used for Agni Karma. And when we consider this materials, that can also be classified based on the origin. That is when we see the materials like Pippali, and here in the commentary it is told like Madhu, Chishta, Sarjarasa, all those also can be used for Agni Karma. So when those substances are taken, we can see that they are plant origin. So based on that origin, again it can be classified as the Upakaranas of plant origin, Upakaranas of animal origin, which includes this Aja, Shakrit, Godanta, etc. as animal origin. And next is Itara Loha, that is metallic. So based on that also there can be classification, Upakaranas of plant origin, animal origin, and metallic origin. So these are the different accessories told for Agni Karma. I think the meaning Pippali, you know, Aja, Shakrit, that is the feces of the god. Then Godanta, you know, Shara is arrow, Shalaka, you know, Jamba Oshta means the Oshta, the stone which is similar to Jambophala, the shape which is the stone which is having the shape of Jambophala. Itar Loha means all those lohas, all those Tamra, Raja, all those substances will be included in the Itara Loha category. Then Kshaudra, Guda, and Sneha. Kshaudra is honey, Guda is jaggery, and Sneha any kind of Sneha dravyas. And by Acharya Vakpada, the materials are Varti. Varti means Pichu Varti. The same Varti can be used for Agni Karma. Then Godanda is same. Surya Kanta means Spatika. Then Sharadibihi, same thing only. Shara, Shalaka, all those things are mentioned. With Adi Shabda is that with that Adi Shabda, it is meant like Shara, Shalaka, Jamboshta, same. That in the commentary it is mentioned like that. Then Madhu Sneha, Jamboshta, Gudadibihi. Same drugs are told by Acharya Vakpata. That is about Dahana Upakarana. And next is where to use these. And so many Dahana Upakaranas are mentioned. So next is where these have to be separately used. And it is told Tatra Vipalyajashakrat Bodhanta Sharashalaka Tvagadana Jamboshti Itara Lohatana Kshaudra Guda Sneha Siras Nikarma. If the Nikarma have to be done at the level of Tvak, if it is Tvak Gada Rogas, then we can use the substances like Pipali and Shalaka, all these can be utilized if it is Gata Vyadi. Next is Jamboshti that can be used when it is Mamsagata. And Kshaudra Guda Sneha can be utilized when it is Sirasnayu Sandhyasti Gata. So based on that, this Dahana Upak description by Acharya Vakbhatta also. So that is about Dahana Upakarana. This next is Dahana Vishesha. Dahana Vishesha here means the pattern.
Hello.
So next is Dahana Vishesha. So what is the pattern of the Agnikarma? Means how the Akriti. Earlier we have told about the classification according to the Akriti. So that is told by Dahana Vishesha. First is according to Acharya Sushruta, that is Tatra Valaya Bindu Vilekha Pratisarananiti Dahana Vishesha. So four types are told by Acharya Sushruta. Valaya means circular, and in the commentary it is told Yadhe Mule Valaya. That is at the root of the disease. In a circular pattern, when the Agnikarma is done, that is called Valaya. Next is Bindu. Bindu means Bindu river, like a point, dot-like shape. That is Bindu. And next is Vilekha. Vilekha in the commentary it is told Tijya Kruju Vakra Vividha Leka Vileka. That is different shapes, making of different shapes by heated shalaka. Vileka can be again divided as Tijyak, that is oblique, Riju, that is straight, and Vakra means zigzag. Okay. So in different patterns, when the Agnikarma is done, that is considered as Vileka. And fourth one is Pratisarana. Pratisarana is told like Kharshana, that is rubbing. Rubbing at the indicated side by heated Shalaka. That is called Pratisarana. These are the four types mentioned by Acharya Sushruta. And according to Acharya Vakbhatta, another three patterns are added. That is Arthachandra, Swastika, and Ashtapada. Arthachandra means crescent shape. Swastika is, while we have discussed about the Yantra, Swastika Yantra, we have seen the Swastika pattern, four-limb pattern. Then Ashtapada means the specific shape containing 8 limbs. These are the three additional Akriti told by, three additional Dahana Vishesha told by Acharya Vakbhatta. So according to Acharya Vakbhatta, the Dahana Vishesha are 7: Valaya, Arthachandra, Swastika, Ashtapada, Bindu, Rekha, and Pratisarana. Next is Agnikarma according to Dhatu. So the sloka, when you see, Tatra Dvividham Agnikarma Mahurege, Tvagdagdam Mamsadagdam cha, Ihatu Sirasnayu Sandhyastishobi na Pradishiddho Agni. So in the beginning, we have seen that on the basis of Dhatu, the Dahana Upakarana was divided. But here, when Acharya is numbering the Agnikarma types, it is told Dvividha. Only he have mentioned about Tvagdagda and Mamsadagda as main. But he is adding that Sirasnayu Sandhyastishobi na Pradishiddho Agni. That it is not contraindicated. Agnikarma is not contraindicated in Sirasnayu Sandhyasti Vyadhis also. But he is giving emphasis on Tvagdagda and Mamsadagda. That is by Acharya Sushruta. But Acharya Vakbhatta have included all the types, means in equal importance, like Tvaji Mamse Sirasnayu Sandhyastishu Sayujyate. And next is how to understand that it is Tvagdagda, Mamsadagda, or the other ones, the features. It is told by Acharya Sushruta, that is Tatra Shabda Pradurbhavo Durgandada Tvak Sankochasya Tvak Dagde Kapoda Varnata Alpashvaidu Vedana Shushka Sankuchita Vranatacha Mamsa Dagde Krishna Unnata Vranata Srava Sannirodhascha Sirasnayu Dagde Ruksha Arunata Karkasha Stira Vranatacha Sandhyasti Dagde. So the features like if there is production of sound, Shabda Pradurbhava, if there is Durgandha, bad odor, and if there is Tvak Sankoja, that is contraction of the skin, then it is Tvak Dagda Samyak Agnikarma Lakshana. Samyak Dagda Lakshana in the Tvak level. Next, it is about Mamsa Dagda. That is, there will be Kapoda Varnata. Kapoda Varnata means color like that of pigeon, that ashy or grey color. Then it is told Alpa Shvedu Vedana, and there will be associated swelling and pain, which will be mild swelling, Alpa Shvedu and Vedana, mild swelling and pain. Then Shushka Sankuchita Vranada. Shushka Sankuchita Vranada means dry contracted wound will be there at the site. That is the signs of proper Mamsa Dagda. Next is Sirasnayu Dagda. Sirasnayu Dagda, Krishna Unnata Vranada. That is black coloration will be there. Unnata Vranada means elevation of the site. Srava Sannirodhasya. Srava Sannirodhasya means there will not be any discharge from the site. There will be cessation of the discharge. When these features are seen, we have to understand that is the sign of proper Sirasnayu Dagda. And the fourth one is Sandhyasti Dagda. And in Sandhyasti Dagda, there will be Ruksha Arunata, dryness, dark red coloration, Karkasha Stira Vranata. Karkasha Stira Vranata means there will be that Vrana, at the site of Agnikarma, there will be roughness and it will be fixed. It will be a stable, there will not be mobility. So if those features are seen, then it have to be understood that it is the sign of proper Sandhyasti Dagda. So that is the description for Agnikarma according to Dhatu. So Tvak Dagda, Mamsa Dagda, Sirasnayu Dagda and Sandhyasti Dagda is told. And accordingly, the features are also told. When Agnikarma, what are the signs of proper Agnikarma on these levels? Tvak Dagda, Mamsa Dagda and Sirasnayu Sandhyasti Dagda. What are the features which will be seen on doing Agnikarma? Next is Agnikarma Kala. Agnikarma Kala, according to Acharya Sushruta, Agnikarma can be done in all seasons. Tatra Agnikarma Sarva Rutushu Kuryat. Then an exception is told Anyatra Sharat Grishmabhyam, except Sharat Ritu and Grishma Ritu. Maybe because Sharat season there is in Sharat season there will be Prakopa of Pitta. So Agnikarma is also aggravating Pitta. Means when the season is also like that, there will be Pitta Prakopa. And that itself can lead to various disorders due to vitiated Pitta. Because of that, it is contraindicated in Sharat Ritu. Similarly, in Grishma Ritu also, it will cause Pitta aggravation. So because of these reasons, it is told Sharat Grishmabhyam, means except Sharat and Grishma Ritu, all seasons we can do Agnikarma. And Tatrapi Atyege Agnikarma Sadhya Vyadhau Tat Pratyanegam Vidhing Ritva. And again it is told, if it is an emergency condition, Atyege, if Agnikarma have to be done and it is a must in case of emergency, then in these reasons also, if it is an Agnikarma Sadhya Vyadhi, then there also we can, in these seasons also we can do Agnikarma, but that Pratyanegam Vidhing Ritva, certain precautions have to be taken. And what are the precautions? Pratyanega Vidhim Viparita Vidhanam, like Shida Chadana, Bhojana, Pradehadikam Kritva. So before that procedure, we have to do some, means take care of something like we have to go for some Shita Upajaras, like Shida Achadana, covering the surface, the area of Agnikarma, means where Agnikarma have to be done, that area have to be covered with Shida Achadana. Cold coverings have to be done. Then for Bhojana also, Shita Dravyas have to be given. Then Pradeha can be done locally with Shita Dravyas. All these precautions have to be done, have to be taken if we are doing Agnikarma in Sharat and Grishma Ritu. And next is another caution laid by Acharya Sushruta, that is Sarva Vyadhishu Ritushu Ja Pichila Mannam Bhaktavata, how the diet should be. And it is told we have to take Pichila Anna. Pichila Anna, it is told like Pichila Anna is Shita and it will act as Pitta Hara. So in such conditions, we have to, when before the procedure, the patient should be given Pichila Anna. And Modagarbha means another conditions are told like in diseases like Modagarbha, Ashmari, Bhagandara, Udara, Asha, and Mukharoga, the patient should not be given food. The patient should be kept abhukta. So that is a caution laid by Acharya Sushruta. Next is indication. So when we see the indication, a number of diseases and conditions have been explained in text where Agnikarma is indicated as therapeutic measure. And we can see Shiroroga, Adimanda, all these conditions where the Agnikarma have to be done. Shiroroga and Adimanda, Ru Lalata Shanga Pradesheshu Dehe. In those diseases of Shiroroga and Adimanda, Agnikarma have to be done in the Bru, that is in the eye, between the eyebrows, in the Lalata Shanka, means forehead, those regions Agnikarma have to be done. And in Vatma Rogas, we have to cover the eyelid with a, means as it is more sensitive area, we have to take additional precautions to take care of the eye when it is Vatma Roga. So we have to keep cotton or wet cloth have to be kept over the eye region, and then Agnikarma have to be done. Then other conditions like severe pain, Bhagandara, Apaji, all these conditions are considered as indications for Agnikarma. Similar description is given in Ashtanga Sangraha and Ashtanga Hridaya also. These are the indications. A number of diseases and conditions have been explained. Next is contraindications. Contraindications, it is told, Adheman Agnina Pariharet, Pitta Prakritim, Anta Shonitam, Bhinna Koshtam, Anudrata Shalyam, Durbalam, Balam, Vrutham, Bhirum, Aneka Vranapidadam, Asvedya shape. So these are the conditions where Agnikarma is contraindicated. So it is like we should not do Agnikarma in persons who are of Pitta Prakriti. You know what it is. Means already Pitta Prakriti means when Agnikarma is done, there will be Pitta Prakopa, so it is contraindicated. Then Anta Shonitam, if there is any internal bleeding or any kind of bleeding disorders, then also it should not be done. If there is any foreign body retained inside the body, Anudhrita Shalya, the Shalya which is not removed, in such conditions, we should not do Agnikarma. Then the universal, all these are also considered as contraindication for Pidita. It is told like Aneka Vyadhi Pidita also. Some take it as Aneka Vyadhi Pidita. That is, if there is any complications, if there is already some complications or some other diseases, comorbidities, then also we should not go for Agnikarma. Asvedya. Asvedya, you know, in Panchakarma you might have already learned. Asvedya means Pandu, Mehi, Raktapitti, Trisharta, that's Loka. All those contraindications for Svedana, same should be excluded while considering the Agnikarma procedure also. That is the contraindications of Agnikarma. So next is Agnikarma Vidhi. We have seen about the indications, means who all can be subjected to Agnikarma. We have seen the Kala, which time it have to be done. We have seen what is the pattern of doing Agnikarma. We have seen what type of food have to be done. All these things we have seen. Now it is the procedure. And a detailed description of the procedure of Agnikarma is available in Ashtanga Sangraha. This is the reference taken from Ashtanga Sangraha. So when we consider the procedure as Purva Karma, Pradhana Karma, and Paschat Karma. As Purva Karma, you know, first is the patient have to be clinically assessed, that whether he is an Agnikarma Sadhya patient, whether we can do Agnikarma or not, that have to be assessed properly. Then if the patient is belonging to that Agnikarma Anarha group, the patient have to be excluded. Then as told earlier, Pichila Anna have to be given, and because Pichila Anna is told like it is having Pittakna quality, so we have to give Pichila Anna to the patient. And then after assessing properly the site, everything have to be fixed, and what pattern we have to do, that all have to be fixed, and accordingly which Dahanopakarna have to be taken. all those have to be assessed, and accordingly all the upakaranas which are required for the Agni Karma have to be kept ready priorly. That is the Purva Karma. Next, about the Pradhana Karma, it is like the patient has to be done Swasthayana, means chanting of mantras, offering worships, taking blessings from the elders or Brahmin, all those things have to be done. Then the patient is told to lie in the Prag direction, that is in the east direction, with the head in the east direction. The patient have to lie down. Then it is told, like other procedures, a parikarmi should be there to maintain or to hold the patient in the desired position. Person should be there. And next is, after keeping the patient in the proper position, next is about the instrument. So the instrument have to be heated. And here in this quotation, it is told like the instrument used for Agni Karma have to be exposed to Nirdhuma Agni. And for creating that Agni, it is told that we have to obtain the Agni by igniting wood from the plants such as Khadira and Badara. The wood is specifically told we have to use Khadira and Badara to make the fire. And with that Nirdhuma Agni only, we have to heat the instrument. And the Agni have to be in the upward moving flame. And when the instrument become Bhasura Varna, the Varna it is told like Bhasura Varna, it should be used for Agni Karma. And meanwhile, throughout the entire procedure, the patient should be given courage. And if needed, cold water sprinkling, everything have to be done on the patient. That is the procedure too. So first thing is about the Pradhana Karma, it is told like first thing is the patient have to be means all those Swasthayana mantras of worships, all those have to be done with the head in the east direction, the Prag Disha. The patient have to be made to lie down, and then a person should be there to hold the patient in the desired position. And then the Agni Karma Shalaka or whatever the Dahana Upakarana is, that have to be heated. And for heating that instrument, it is told that the Agni should be made by igniting Khadira and Badara. With that Nirdhuma Agni, the instrument have to be heated, and then the instrument have to be become Bhasura Varna. That is the apt time or apt heating period told. Then Agni Karma have to be done in the desired Akriti, in the desired site, it have to be done. And throughout the procedure, the patient should be given courage by consolating words, as well as if necessary, cold water can be given to drink or cold water sprinkling can be done. That is Pradhana Karma. Next is Paschat Karma, and in Paschat Karma, it is told like Madhu Sarpi Abhyanga. At the once the proper Agni Karma is means Samyak Dagda Lakshanas are obtained, we can apply Madhu and Sarpi over the region. Also, it is told like certain other drugs are also told that we will see in the coming sections, because detail according to the Dagda Lakshana, detailed Chikitsa has been explained. So that is the Agni Karma Vidhi, Purva Karma, Pradhana Karma and Paschat Karma. So this is the normal procedure wherein different types of shalakas are there now. Swarna Shalaka are also used by certain surgeons. And accordingly, whatever Shalaka or Dahanopakarna is available, that is selected. And now different sources of heat is used. Source of fire, whatever it is available, whatever it is convenient, that can be utilized. Then Shalaka have to be heated. Then the area should be cleaned first. Then we will apply this Shalaka. The heated Shalaka will be applied. And in some cases, we will apply Shadasauda Krita. After heating is done, after the point is burnt, we will apply Shadasauda Krita. In some cases, we will go with Sarpi and Haridra, which will act as Pranaropana. Then in some cases, Kumari Swarasa, aloe vera, along with Haridra will be mixed, and that paste will be applied. That differs. These are the practically utilized techniques. And before the application of this Shalaka, we will mark that most tender points. In case of frozen shoulder, in case of low back pain and all, we will mark the most tender point. And on that point only, we will do the karma. That is the usually practiced way. Next is about the Dagda Lakshana. So different kinds of dagda are mentioned. Mainly it is 4 types. Tatra plushtam, durdagdam, samyak dagdam iti. Samyak dagdam, adi dagdam chedi, chadurvidam agni dagdam. 4 types of dagda are told. This is by Acharya Sushruta, and slight difference is like tucha. Tucha is told by Acharya Vagbhata. Other than that, all the 3 types are same. So Acharya Sushruta tells Plushta, Durdagda, Samyak Dagda, and Adidagda. Acharya Vagbhata tells Tucha, Samyak Dagda, Durdagda, and Adidagda. And now the features. The features it is told like first is Plushta. Tatra yat vivarnam plushyate atimatram tat Plushta. So what is the Plushta Dagda Lakshana? Yat Vivarna, there will be discoloration. From the normal color, there will be discoloration. Plushyate Adimatram, that is, there will be severe burning sensation in the site. If those features are there, then it is considered as Plushta or Tucha. Same thing, that is the first type. Next, it is Durdagda. Yatra uttishtanti spota tivra chosha daha raga paga vedana chiracha upashamiti tad Durdagda. Next is the Durdagda type. It is told like when there is yatra uttishtanti spota, when there is boils appearing over the site, when there is tivra chosha daha raga paga vedana, all these features like burning sensation, discoloration, when all these are accompanied, then chiracha upashamindi, and this boils or the symptoms will take a long time to subside. When these features are present, then it is considered as Durdagda. That is the second type. So first we have seen Plushta or Tucha. Next is Durdagda. In Tucha or Plushta, it is like there will be discoloration and there will be severe burning sensation. There will not be any ulcer formation or any boil formation. That can be taken as first degree burn. Next is Durdagda, wherein there is appearance of boils at the site and there will be associated discoloration, reddish discoloration, pain, burning sensation, and all these symptoms will take a long time to heal or subside. Third one is Samyak Dagda. Samyak Dagda, it is told Samyak Dagdam Anavagadham Talavarnam Susamsthitam Purva Lakshana Yuktam Cha. Samyak Dagda Anavagadha. It will not be that deep. Talavarna. It will be in the color of a ripe fruit of Talafala. Then Susamsthitam. There will not be an irregularity in the surface. It will be even. And Purva Lakshana Yuktam Cha. Purva Lakshana Yukta here means those symptoms or those features which we have told in Twagdagda, Mamsa Dagda, Sirasnayu Sandhyasti Dagda. All those features which we have told there, that should be understood by the term Purva Lakshana Yukta. Those features have to be seen. When it is done in the Twagdagda, those along with this Anavagadha, Talavarna, Susamstida, those features have to be taken. Similarly, the other 3 also. Purva Lakshana Yukta here indicates that sloka. That is about Samyak Dagda. Next is Adi Dagda. In Adi Dagda, what happens is Mamsa Valambanam, Gatra Vishlesha, Sirasnayu Sandhyasti, Vyabadanam Atimatram, Jwara Daha Pipasa, Murchascha Upadrava Bhavanti. That is when it is Adi Dagda, the 4 degree burn, deep burns we will take. And in such cases, there will be hanging of the burn tissue. Severe burn have occurred and there will be hanging of the burn tissue. There will be disorganization of the body parts and the deeper tissues like Sira, Snayu, Sandhi, all these will be destroyed. And in addition to that, some systemic illness like Jwara, Daha, Pipasa, all those systemic illness also will be accompanied. That indicates the complications. And it is told about that is the systemic complications, and the local complications it is told like Pranaschasis Chirena Rohadi, the wound created by this Adidagda that will take a long time to heal. And Rudhascha Vivarno Bhavati, that is from that word we can take the scarring or keloid formation, all those complications. Even though it is healed, then also there will be Vivarnata, scarring or discoloration which will be present even after the wound heals. That is the Deda Chadurvidam Agni Dagda Lakshana. So these are the 4 types of Dagda Lakshanas: Plushta, Durdagda, Samyak Dagda, and Ati Dagda. Next, it is about the Chikitsa. Separately, the Chikitsa is told. First is Plushta or Tucha Chikitsa. It is told like Plustasya Agni Pratapanam Karyamushnam Tadaushadam Sharire Swinna Bhuishte Swinnam Bhavati Shonitam Prakrutya Hyudakam Sheetam Skandetyati Shonitam Tasmat Sukhayati Hyushnam Nanu Sheetam Kadanjana. So in Plushta, it is told like Agni Pratapana. Agni Pratapana means Svedana only. And Karyamushnam Tadaushadam. We have to do Ushna Kriyas. Using Ushna Aushada, Ushna Alepa, we have to do Ushna Kriyas in case of Plushtadakta. Why? Sharire Swinna Bhuishte Swinnam Bhavati Shonidam. That is, when this Sharira Svedana is done, the Shonita will also get liquefied. Otherwise, what happens if we use Shita, Prakritya Hyudakam Shitam Skandetyati Shonitam? When we use Shita, the Shita by nature, it is having a tendency to solidify the blood. The blood will float. So, to remove the blood or to get the proper Vilayana, it is told that we have to go for Ushna Kriyas. Tasmat Sukheti Hushnam Nanu Sheetam Kadanjana. So, it is advised to use heat and hot therapies, not cold, to treat the Plushtadagda. Okay, that is the treatment. So, in Plushtadagda, we have to go for Svedana, Agni Pratapana and Ushna Aushadas instead of Shita Kriyas. Same is told for Tucha also. Next is Durdagda. Durdagda Chikitsa, it is told Shita Mushnam cha Durdagde Kriyam Kuryat Bhishak Puna Krita Alepana Sekastu Shita Nevasi Karye. So here it is told in Durdagda Shita Mushnam cha Durdagde Kriyam Kuryat Bhishak Puna. That is, both Shita Kriya and Ushna Kriya can be done in Durdagda. Then we'll be having a doubt how. It is told in the commentary that Durdagde Avagadha Mula Dagda Bhagasya Swinna Raktasya Nirvapanatam. Clause is told. That is, in Durdagda condition, if it is Avagadha Mula Dagda Bhaga, that is the burnt area or the wound created as Avagadha, if it is deep, and Swinna Raktasya, already the Rakta is in the Vilayana form, in the Swinna, it is already in the liquefied form, then we can go for Shita Kriyas. And Anavagadha Mula Dagda Bhagasya Aswinna Raktasya. In conditions where the burnt site is Anavagadha, if it is not that deep, and if the Rakta there is Aswinna, if it is solidified, then to liquefy that blood, we have to go with Ushna Kriya. So, like that, it is told that Shita Mushnam cha Durdagde, both Shita Kriyas and Ushna Kriyas can be done. Another explanation is given like Shitam Daha Atishaye Nati Dahe Ushnamiti. That is, in conditions where there is associated severe burning sensation. In such conditions, Shita Kriya have to be done. If there is not that much severe burning sensation associated with the Dagda, then there we can go with Ushna Kriyas also. That is another explanation given in the commentary. And next it is told like what are the procedures that can be done. Krita Alepana Sekastu Shita Nevasi Karya. And all those procedures like Krita, Lepana, Seka, etc. can be done with Shita only. Shita Kriyas only can be done. That is for the Vrana Ropana, that will be helpful. That is the Durdagda Chikitsa. Next is about the Samyak Dagda Chikitsa. In Samyak Dagda, certain drugs are mentioned like Samyak Dagde, Tukakshiri, Laksha Chandana Gairikaihi, Samritai, Sarpisha Snigde, Ralepam, Karayed Bhisha, Gramya Anupa Udakesh Chainam, Pishter Mamse Pralepayet, Pitta Vidrativat Chainam, Santatoshmana Machari. That is drugs like Vamsharojana, Rakta Chandana, Gairika, Amrita, Guduji. All these drugs can be mixed with Sarpi. And then it will be made into a Snigdha Alepa. Right, when it is mixed with Sarpi, it will become a Snigdha Drivya. It will be Snigdhikrita, and then it can be applied over the site because it will act opposite to that Pitta, means it will be Pitta Pratyanika. That Lepa will act as Pitta Pratyanika because it is a Snigdha Alepa that will act on the site and it will help in the healing. Similarly, Gramya Anupaodakesh Chainam, Pishter Mamse Pralepe. Another Lepa is told using the Mamsa, like Gramya, Anupa, Audaga Mamsa. Different kinds of Mamsa can be made into paste and that also can be applied as Lepa. Then next is Pitta Vidradi Vachanam. All those treatments told in Pitta Vidradi. That also can be done. That is about Samyak Dagda Chikitsa. Next it is Atidagda Chikitsa. Atidagde Vishirnani Mamsani Udhrita Shitalam Kriyam Kuryat Bhishak Paschat Shali Tandula Kandanaihi Tindugi Tokkapalerva Kritamishtrai Pralepet Pranam Guduji Patrerva Chadayet Adhavodage Kriyam cha Nikhilam Kuryat Bhishak Vitta Visarpava. So in Atidagda it is told like Vishirnani Mamsani Udhrite Shitala. So we have told that in the features of Atidagda Agni Karma means when the burn is that much deep, we have told that there will be Mamsavalambana. Right. So that have to be removed. Vishirnani Mamsani Udhritya means that Avalambita Mamsa have to be removed and Shitalam Kriya. We have to go with certain Shitala Kriyas. Like Lepa with Shali Dandula Kantana, Tindugitwak. All these can be mixed with Krita and Lepa can be done. And another thing is using Guduji Patra, covering the part with Guduji Patra or any other Audagai, means Patma Utpala, all these leaves can be used. In addition, means either with Guduji Patra or any kind of those aquatic plant leaves can be utilized. Example is told like Patma Utpaladi Patra. And Chade Dadaodahi, that wound, that Vrana can be covered with such leaves. Then Kriyam Chanikilam Kudyat, Hishak Pitta Visarpavat. All those treatments told in Pitta Visarpa Chikitsa. That also can be done in Adidagda Avastha. So that is about Plushta, Durdagda, Samyak Dagda, and Adidagda Chikitsa. So in first thing, Plushta Dagda, we have seen that we have to do only Ushna Kriyas because Shita Kriyas will cause Skandana, Rakta Skandana at the area. So we will go with Ushna Kriyas. In Durdagda, we have seen that we can do both Shita and Ushna Kriyas based on the Avastha. In Samyak Dagda, we have seen about certain drugs can be used for Lepa. And then Pitta Vidradi Chikitsa is also told. Next is in Adidagda, the Avalambita Mamsa have to be removed and Shitala Kriyas are told. Certain drugs have been told to make that lepa, and another is using the leaves of guduchi or other aquatic plants, that wound can be covered. That is the treatment. Another things told in this chapter is like Dhumopahata Lakshana and different kinds of burns. Dhumopahata Lakshana means when someone is afflicted with, it can be taken as inhalation injury or something like that. The condition due to inhalation of smoke in any kinds of burning in any circumstances when there is inhalation of smoke, then what is the features and what can be the treatment given for such a person? That is Dhumopahata Lakshana and Chikitsa too. Shvasadi Kshautita cha Atyartham Atyadhamati Kasate Chakshusho Paridahascha Ragashcheva Upajayade Sadhumagam Nishwasiti Prayam Anyanna Veticha Tadheva cha Rasan Sarvan Shrutischa Upahanyate Trishna Daha Jvarayuta Sidatyadaja Murchadi Dhumopahata Ityasha. These are the symptoms told. This much is the symptoms. That is Shvasidi Kshaudi cha Atyartham means it is an inhalation, as I have told, it can be taken as inhalation of smoke. So as this smoke is entering into the lungs or into the respiratory organs, it will cause severe shwasa, means dyspnea. It can cause sneezing, cough, all those symptoms will be produced. Then kasa, means cough also. Then chakshusho paridahascha ragascheva ubajayade. Due to that smoke or due to that emitting of that substances, what happens? It will afflict the eyes also. The eyes can become red, as well as there will be burning sensation in the eyes. Sadhumakam nishusidi krayam anyatnam mitija. That is when the person exhales or inhales, there will be smoke. Smell of smoke will be there and emitting of smoke from the nose. That also will be happening. And the other than the smell of smoke, the person will not be able to perceive other smells. Next, it is Tatheva cha Rasan Sarvan Shrutishasya Upanyate. That is, totally the sense organs will be affected. Means rasa. There will be loss of perception of the taste. Then Shrutishasya Upahanyate. He is unable to hear anything. Then Krishna Daha Jvarayuta Sidatyadajam. Other illnesses like there will be thirst, there will be burning sensation, fever, other systemic illness also will be occurring in such persons. That is the local symptoms, the sensory symptoms, as well as the other systemic illness also that is developing due to inhalation of smoke. That is explained here. Next is Shrunutasya Chikitsa. Next is its Chikitsa. सर्पिरिक्षुरसं द्राक्षां पयो वा शर्कराम्बु वा मधुराम्लो रसो वापि वमनाय प्रदापयेत् वमतः कोष्ठशुद्धिः स्यात् धूमगन्धश्च नश्यति विधिना अनेन शाम्यति सदनक्षवधुज्वरा दाहमूर्छा दृढात्मान श्वासकासाश्च दारुणा मधुरैर्लवणाम्लैश्च कटुकै कवलग्रहे सम्यक् गृह्णाति इन्द्रियार्थान् मनश्चास्य प्रसीदति शिरोविरेचनं चास्मै दद्यात् योगेन शास्त्रवित् दुष्टर्विशुध्यते चास्य शिरोग्रीवं च देहिना अविदाहि लघुस्निग्धम् आहारं चास्य कल्पये. So it is told about the treatment. Here it is told that Vamana. First treatment is told like we have to go for Vamana. And for Vamana, certain drugs are mentioned. Sarpi, Ikshurasa, Draksha. All these substances can be used. And with these drugs or with these medications, we can do the Vamana. And it is told Vamana, Vamataha Koshta Shuddhisya. When the Vamana procedure is done in a proper manner, it helps in the Koshta Shuddhi. Because the smoke can enter into the Koshta here not only means the gastrointestinal tract, but entire internal system it is indicated here. So if there is a chance that the smoke enters into the gastrointestinal tract also, that also will be get cleared by the Vamana. So Vamataha Koshta Shuddhi Syat Dhumagandhasya Nashyati. That Dhumagandha, which is told in the symptoms, that Dhumagandha will be getting relieved. Vidhina anena shamyanti sadana kshavadujvara daha murcha tridhatmana shwasakasasha dharana. That is, by proper Vamana, it will help in relieving the other symptoms like all those systemic illnesses, daha, murcha, tridhatmana, all those symptoms also will be relieved by proper Vamana. Then it is told Madhare Lavana Amlesha Kaduke Kavalagrahi. We have already told that there is means the sensory systems, sensory organs are also afflicted so much. So accordingly, if Kavalagraha is done with Madhura Amla Lavana Dravyas, that also will helps in attaining the proper perception of the sense. Means taste, smell, all those which is afflicted due to the dhuma, that will also get cleared. Manaschastya prasidati. That will result in the mana prasadana also. Then it is told about Shiro Virejana. Shiro Virejana, by Shiro Virejana, it will help. Shiro Virejana, you know, it is very much indicated in all kinds of Jatrurtha Vigaras. So by doing proper Shiro Virejana, that will in turn act on the Drishti Vishuddhi. That is, we have told there will be Raga, there will be Daha in the Chakshu. So that will be relieved by proper Shiro Virejana. And all those diseases or all those symptoms associated with Jatrurtha, that will be relieved by Shiro Virejana. And next it is told that what kind of ahara can be given. Avidahi lakusniktam aharam jasti kalpet. And in such a person, in addition to these treatments, the diet should be avidahi, lakhu and snigdahara. The ahara should be avidahi. It should not cause vidagdavastha. It should be lakhu and snigdha in nature. So that is about dhumopahata lakshana and its chikitsa. So in chikitsa mainly Vamana, Kavalagraha, Shiro Virejana. These are the main treatment modalities told, and in addition to that, diet is also explained. And another thing which is explained in the chapter as such is the Dagda caused by Ushnavata, Adaba, Chita Varsha, Anila, etc. And for that also treatment is told. Like in Ushnavata and Adaba, when that causes Dagda Avastha, then we have to go with Shita Kriya. And similarly, when Shita Varsha, Anila, etc. are causing Dagda Avastha, we have to go with Snigdha and Ushna Kriyas. Similarly, when there is lightning, all these conditions, when the dahana is caused by all those factors, it is told that if that person survives, then we can go for Sneha, Abhyanga, Parisheka, Pradeha, etc. That is also told in the chapter. When we deal with the burns, we will see different kinds. Due to different causes, different types of burns can occur. So these can be correlated to those modern aspects. Okay, that is what is explained in the chapter Agnikarma Vidhi. So next is about the Modern correlation. Mainly, Agnikarma in the modern view can be correlated to cauterization, that is the destruction of tissues by using hot instrument or electric current or caustic substances. Based on that, it is divided as electric cauterization, chemical cauterization, and all. And the tool used for cauterization is called as cautery. There are various methods of cauterization, like as I have told, electric cautery, cold cautery, which is done by using carbon dioxide, then gas cautery, which is done by using specially controlled jet of burning gas, then solar cautery, Corrigan's cautery. So many different types are mentioned. In addition to that, different heat treatments are there, both superficial and deep. Superficial heat means in forms of hot water bottles, warm packs, heat pads. All these comes under superficial heat treatments. Similarly, deep heat treatments include this diathermy, ultrasonography, etc. That is, high frequency electric current is needed in diathermy, and this diathermy can be used to treat bursitis, sinusitis, all these conditions. It is indicated. It reduces the pain, muscle spasm, inflammation, and also helps in the healing. And the mode of action, it is told like when heat is applied to the body, there will be an elevation in the temperature, which in turn causes vasodilatation. And there will be increase in the waste product elimination. Proper circulation will be, means local circulation will be increased, and the metabolism will be proper. And thus, in turn, there will be reduction in the pain and it will promote the muscle relaxation. And so it will help in relieving the pain, help in relieving the muscle spasm. It acts as an analgesic, and healing also will be, because of good circulation, healing also will be accelerated. And so it can be used in chronic inflammatory conditions also. That is about cauterization. Next is moxibustion. That is a traditional Chinese medicine technique, which also involves the burning of a drug. A drug in the sense a small spongy herb called as mugwort or Artemisia vulgaris. So that drug is burnt, and it is burnt and kept on specific sites of the body to facilitate heat. So it is the purpose of moxibustion. It is like to strengthen the blood, to stimulate the blood flow, and to maintain general health. And this therapeutic procedure also parallels Agnikarma in approach. So I have taken that also. And the method is told like the dry powder of the leaf of this drug, Artemisia vulgaris or moxa, that is used here. And hence the term or the method is termed as moxibustion. It also serves as a purpose similar to acupuncture only. That is, the application of heat over the painful area in the body. It helps in relieving the pain, and especially the center of painful area is selected, and there heating is done, and hence the results are much better. It is also known that it will increase the number of red blood cells, it will increase the percentage of hemoglobin in blood, etc. are also told. And in the picture you can see, that is, the leaves of Artemisia vulgaris are dried in sunlight, and it is powdered, and it is got into a wool like texture, and this material known as moxa wool is kept over the site of the body, and heating is done. That is moxibustion. Next is about burns. Burns, by definition, it is defined as a wound caused by exogenous agent leading to coagulative necrosis of the tissue. And there are different causes of burns, like open fire while cooking in the field, by means with boiling liquid, burns can occur. Electrical, acids, different causes are told for burns, and based on these causes, like what means, if it is from direct burning fire, if it is caused due to any chemicals, if it is caused due to any electric current or something, based on that classification is done. Different types of burns are told. First one is thermal injury or thermal burns. Thermal burns include the scar, that is spillage of hot liquids, then flame burns, then flash burns like exposure of natural gas, combustible liquids, contact burns. All these comes under thermal burns. Next is electrical burns. electrical burns, that is accidental electrical contact. And that depends, that severity of the burn depends on the strength of the electrical voltage. There is low voltage and high voltage, and based on that, the severity may vary, and the duration of contact also determines the severity. That is electrical burns. Next is radiation burns. UV light, X-ray, radiation therapy, all these can cause radiation burns. And the effect means the effect of the burn is determined depending on the amount of exposure to the area. That is almost similar to the other thing also. The duration and the exposure will determine the severity of the radiation burn. Then chemical burn means burns due to strong acids or strong bases. And in chemical burns, the tissue destruction is more and progressive, and it is always a deep burn. That is chemical burn. Then cold injury, it is due to long-term exposure to cold or low temperature. Usually affects the fingers, toes, nose, and ears. There will be numbness, pallor, severe pain, and etc. at the site of exposure. And intervention, it is told like we have to warm the area rapidly and continuously. Inhalation injury, that is what is correlated to dhumopahada. And in inhalation injury, it has significant impact on the survivability of a burn injury. That is, it has three components: carbon monoxide intoxication, upper airway swelling, acute respiratory failure. So these three components, it can occur alone or it can occur in combination. So if these components are not that much severe, if it is occurring alone, in such conditions, the survivability will be more. The condition will not be that critical. But in conditions where all these three components are occurring in combination, and that too in a severe form, then that the condition will be life threatening. So based on that, the inhalation injury can be inconsequential as well as it can be life threatening also. That is inhalation injury. Then next is about the classification of burns. So classification of burns depending on the thickness of the skin involved. Based on the thickness of the skin involved, that is, different layers: epidermis, dermis, subcutaneous fat, muscle, all these layers are there. So based on the layers involved, the burn is classified. And first classification is like first degree. First degree means here the epidermis looks red and painful. The epidermis, the topmost layer, looks red and painful. There will not be blister formation, and the burn will heal rapidly in 5 to 7 days without any complication like scarring and all. It will heal within 5 to 7 days. That is first degree. Next is second degree. There, the affected area will be mottled. There will be red, painful blisters will be present, and it will take much more time to heal. That is around 14 to 21 days will be taken for the healing. And next is the third degree. Third degree means the affected area is charred. That is, that much burn have happened, and there the area will be painless and insensitive. And the intervention also will be, it will be requiring grafting and all. That much severe burn might have happened. That is the third degree. Fourth degree means the underlying tissues are also involved, like muscles, bones, all these are also involved. That is considered as the fourth degree. That is burn classification depending on the layer of skin involved, or the depth of the skin involved. Okay, first degree, second degree, third degree, and fourth degree. Again, this based on the thickness of skin involved, there is two classifications like partial thickness burns and full thickness burns. Partial thickness burns means it is either the first or second degree, where there is red and painful, often with blisters. But full thickness burns means it is the third degree where, or fourth degree, where there is charring of the skin. There will be insensitivity, there will be all those complications will be associated. That is partial thickness burns and full thickness burns. That is also a classification on the basis of the thickness of skin involved. Another thing is the severity of the burn. Based on the severity of the burn, there is burn severity is assessed like mild, moderate, major, etc. Mild or minor, that is condition where means based on the percentage of burns it is assessed. That is, in a superficial burn, if there is less than 50% of superficial burn, then it comes under the minor category. Similarly, when the partial thickness burn is less than 15%, that is also considered as minor or mild category. And full thickness burn less than 2%. All these three comes under the heading mild or minor. Next is the moderate. That is, depending on the percentage of burns, the burn severity classification is done. Burn severity classification is mild, moderate, and major. And on the basis of the percentage, we are classifying it under these headings. So we have seen about mild. Next is moderate. Moderate, the superficial burn if it is greater than 50%. 50% of the body surface area. That is, BSA indicates body surface area. So if the burn is greater than 50% in the superficial case, that comes under moderate. Similarly, partial thickness greater than 15% and full thickness greater than 2%. All those three come under moderate. Third one is critical, major or severe. In that, the partial thickness greater than 30%, full thickness greater than 10%, and inhalation injury. Those three are included under critical or major or severe category. That is the classification of burn severity classification depending on the percentage of burns. So that is another classification tool. Next, it is about the assessment. Assessment of burns. There are different techniques tool like Wallace's roll of 9, Lund and Browder chart. Another is patient entire hand area. That is, the entire hand area is taken as 1%, and a clean piece of paper is cut to the size of the hand, and through that the percentage of burn is assessed. That is, that area is taken as 1%. So, and a piece of paper is cut in the shape of that area or according to that size, and with that paper we will assess the percentage of burns. These are the three methods widely used for assessment of burns: Wallace's rule of 9, Lund and Browder chart, and this area of palm, entire hand area when taken as 1%, and that is assessed. Next is about the pathophysiology. So in the pathophysiology, when we see, this is the Jackson's theory of thermal wounds. Jackson's theory of thermal wounds means when a burn occurs on the skin, it causes changes on within the skin, and that could be divided into sort of three regions or three zones. These zones of the burns are described by Jackson in 1947, and so it is called the Jackson model or Jackson's theory of thermal wounds. The first zone is the zone of coagulation. Then it's the zone of stasis on the outside, and further part is the zone of hyperemia. So these are the three zones. Zone of coagulation is essentially the point of maximum damage. In this zone, there is irreversible tissue loss due to coagulation, and there we will get the coagulative necrosis. That is about zone of coagulation. Next is zone of stasis. Stasis zone is essentially characterized by decreased tissue perfusion. This ischemic zone may progress to full necrosis unless the ischemia is reversed. That is about stasis zone. Next is the third zone, that is at the outside. It is the zone of hyperemia. In this zone, tissue perfusion is increased and the tissue here is invariably recovered. It is the last zone, so it is invariably recovered unless there is severe sepsis. If there is severe sepsis and all, there also the tissue destruction will be more, but other than that, it is invariably recovered. If there is no severe sepsis or prolonged hypoperfusion, that zone is told like there will be increased tissue perfusion and the tissue here is invariably recovered. And when we see the zone of stasis, that stasis zone is characterized, as I have told earlier, that stasis zone is characterized by ischemia and it may progress to full necrosis. If the ischemia is not reversed at proper time, then there will be full necrosis, complete tissue death will be there, and that will lead to further complication. So therefore, the main aim of burn resuscitation is to increase the tissue perfusion at this zone. And we have to prevent the further damage. That is told by Jackson. That is the Jackson's model. So here in the pathophysiology, if we see, this can be taken as two, that is in the left side, it is about the superficial burn. Next is about the deep burn. In the superficial burn, you can see superficially the burn is happening, and because of that, there will be damage of the keratinocytes, and there will be immune response that this the mast cells, all those cells will act, and there will be a release of cytokines. This cytokines will act differently, like the cytokines will stimulate the nerve endings and it will cause pain. The cytokines will increase the vascular permeability, and thus the fluid will be shifting from the vessels, and there will be hypotension, there will be vasodilatation, and sometimes there will be blister formation due to this increased permeability. So these and all will be happening in the superficial burns. In the deep burns, directly there will be destruction of the blood vessels, which in turn will cause all these features like hypotension, interstitial edema, increased vascular permeability, all these will happen. So as a whole, when the pathophysiology of burn is taken, the heat will cause coagulation, necrosis of skin and subcutaneous tissue. And as a result, there will be release of certain substances like vasoactive peptides and all. And there will be alteration in the permeability. There will be loss of fluid from the spaces. And finally, it will cause severe hypovolemia. And this hypovolemia will in turn lead to damage in other systems or other major organs. Like this severe hypovolemia can cause decreased cardiac output, it can cause decreased renal blood, and some cases there will be infections also. So further, these systems or these organs will develop damages, and in case of infection itself, there will be sepsis. That sepsis can in turn affect the different systems. And finally, when there is severe sepsis, when there is septic shock, there will be multiple organ dysfunction, and it can lead to death also. That is the pathophysiology. So this is the process what is happening in the burn. So there will be, due to the heat, there will be coagulation necrosis, there will be a release of vasoactive peptides. Because of that release of these substances, there will be altered capillary permeability, loss of fluid will takes place, and that will cause a severe hypovolemia. This hypovolemia will in turn act on different systems like decreased cardiac output, decreased renal blood. Major systems will be affected, and if there is infection, that also can lead to different system involvement, and finally it can result in multiple organ dysfunction and even death. Then how this systemic changes, like pathophysiology, we have told that what is happening in the pathophysiology. Now it is how the systems are differently affected. That is, in severe burn, there is altered hemodynamics. There will be fluid electrolyte imbalance. There will be hypermetabolism. So metabolic changes will occur. The increased gut mucosal permeability, that will cause GIT changes, acute gastric dilatation, paralytic ileus, all those GIT changes will occur. Decreased renal blood flow. So renal changes will occur. Immunosuppression. Infection will be more prone. Then vascular permeability and edema. That is, in turn, there will be massive edema in the body due to this altered pressure gradient and all. So many systems will be affected due to the burn. So as sum up, if we tell, the effects of burn injury will include shock. It can include renal failure, respiratory failure, infections which can lead to bacteremia, septicemia, etc. GIT can be included, means involved. Fluid and electrolyte imbalance occurs, and locally also, if we see, there can be, means at the site of burn, there can be formation of keloid, formation of contractures, Ishar formation, fractures in case of electrical injuries. Different kinds of effects can occur based on the severity of burn, or based on the exposure and contact, there will be different effects. Next is about the management. First thing about the management is the first aid. First aid is like we have to stop the burning process, and the patient should be kept away from the burning area. And next thing is we have to cool the area with the means burnt area with tap water by continuous irrigation for about 20 minutes. We have to use tap water, not cold water, because cold water can cause hypothermia. And next is about the definitive treatment. That is, we have to admit the patient to the hospital. We have to maintain the airway, breathing, circulation, all those the treatment. So first is about the first aid. And in first aid, I have told first thing is we have to stop the burning process, or we have to keep the patient away from the burning area, and the area which is burnt, that area have to be cooled by continuous irrigation of tap water for about 20 minutes. And definitive treatment is like we have to admit the patient, and we have to maintain the airway, breathing, circulation and all. And next is the percentage, degree, type, everything have to be assessed. And always keep the patient in a clean environment, because the chance of infection is high. So always the patient have to be kept in a clean environment. And as there will be associated pain, all those discomfort, better to give the patient sedation and proper analgesia. Then fluid resuscitation, of course there is hypovolemia, so we have to go for fluid resuscitation. Then to monitor that input output and all, better to go with urinary catheterization. Then tetanus toxoid can be given. Proper monitoring of the patient, like BP, uh, oxygen saturation, everything have to, pulse rate, everything have to be monitored at regular intervals. Then Ryle's tube insertion can be done, because first it is to be done to do the aspiration, and later for feeding also Ryle's tube can be inserted. Then antibiotics, as the chance of infection is more, antibiotics can be started. Then there will be, means for faster recovery and for the improvement of general health of the patient, better to go with TPN, that is total parenteral nutrition. Then if there is respiratory involvement, or if there is any other respiratory failure impending, there is if the chances are there, then we can go for tracheostomy or intubation tube, and intensive nursing care is suggested. And then about the local management like dressing, using different means app drugs, dressing can be done. That can be done in open method and closed method also. Open method means without any dressing, local application of sulfadiazine, such drugs can be done, especially in burns of face, head and neck. Open method is advised. Then closed method is like after application of ointments or something, dressings will be done. Then skin grafting, then mesh skin graft, all those things can be done according to the severity of the condition. Excision of burn wound with skin grafting, all these techniques are advised. Then slough excision have to be done. So slough should not be kept at that area. Regularly that slough have to be excised to promote the healing and to promote the growth of new tissues, healthy tissues. Slough excision have to be done. And next is ischorotomy. Ischorotomy means eschar formation means there will be scab formed at the site of burn. It is charred, denatured, full thickness, deep ones with contracted dermis. It will be insensitive, that will form over the area. So that will be thick. And so that is called eschar. And that there we have to do longitudinal full thickness incisions. That is to prevent collection of edema fluid under that area, because there will not be, because of this eschar formation, the fluid will not get outside. So to prevent that collection of edema fluid, we means if required, we have to do deep longitudinal full thickness incisions. The site is given there in the picture. So that process is called ischorotomy. That have to be done if there is eschar formation, and to prevent that collection of edema fluid, and to prevent the compression of vessels. When the edema fluid gets accumulated, that will cause damage to the adjacent structures. So to prevent that compression of over the vessels and to prevent the collection of edema fluid, we can do incisions, deep longitudinal full thickness incisions in different areas accordingly. That process is called ischorotomy. That is also a management technique. Similarly, multiple incisions or incisions over joints whenever it is needed, that also can be done. Next is the contracture. Contracture in the wound means there will be tightening or shortening of the tissues due to the damage of the tissues or the burns involving the muscles, tissues, etc. There will be tightening or shortening of the involved tissues. That is called contracture. So that burn wound will be contracture will be present in that burns. Mainly, it was affecting places like joints, eyelids, cheeks, etc. So in the picture, you can see the knee joint is affected, the face, chest region, all those places there is contractures present. Contracture is of two types. It can be intrinsic and extrinsic. Intrinsic means by the loss of tissue. When tissue loss is happening at the site, that because of that there will be tightening. That is intrinsic. And when during the process of healing, that healing phase, when there is pull, that can cause extrinsic contractures. So that is about contracture, which is a complication of burn wound. And this there can be complications for this burns contracture. That is due to this contracture, other complications can occur. That is in this picture we can see, that is in the eyelid there will be ulceration, there will be keratitis and disfigurement of face. In certain cases, when mouth, that region is much more affected, there will be narrowing of the mouth. Then when there is contracture in the neck region, there will be restricted neck movements. Similarly, the joints when affected, it will lose its ability to function. The joints will become non-functioning. And other complications of the contractures is like keloid formation. There will be hypertrophic scar formation. Then ulcer over the contracture, that is Marjolin's ulcer. So these also can happen over the contractures. For contractures also, different types of surgical procedures like skin graft, plasty, etc. are mentioned. And for facilitating the movement, proper physiotherapy, rehabilitation, etc. are advised. Then to prevent the hypertrophic scars and all, pressure garments are told. And in addition, if there is itching and all, accordingly, medicines can be prescribed. That is about burns. I think in the notes, detailed description about other types of burns is given. So in total, today we have discussed about Agnikarma as such. The detailed description given in Sushruta Samhita. Then about its modern correlation, that is cauterization. Then about moxibustion, that is a Chinese traditional technique. Then we have seen about burns. Burns in detail about each type of burns and all. In the notes it is given. So that is about today's class. Any clarifications needed?
Ma'am,
Yes.
Basuravarnam.
Actually, it can be taken as in some cases it is red hot. Okay, that much heat should be applied over the surface, and that redness is indicated by that. So practically, we in some cases we will keep the shalaka till it becomes red hot. Some cases depends.
Binna
Pardon?
Costa. Binna Costa.
Bhinna Koshta means internal breeding conditions, because when you learn about Brana in detail, you will see about different kinds of Branas, that is by different traumas when Branas occur, when wounds occur. In that internal bleeding, when there is injury to the Koshta and all, that time internal bleeding, that conditions are given under Bhinna Koshta. All those disorders which causes internal bleeding, internal injury.
Ma'am,
Pardon?
Biru.
Viru means coward, means fearful person, means who is having fear for everything. Those are like means whenever we discuss about the procedures, mainly those kind of persons are contraindicated. This Durbala means weak patients, means by health or mentally also they will be weak. They will not be having that capacity to face the procedure. So the desirable result will not be obtained.
Ma'am, Tarka is contraindicated in your notes, ma'am.
Pardon?
Tarka.
I'm not. One second, you just tell.
Tarka, Dagda. There's a Patya Apatya, ma'am.
Patya Patya.
Yes, ma'am.
Let me see.
In the slide. 7th slide, ma'am.
Okay, 1 minute. I'll see. In the notes, you are saying
Yes, ma'am.
that is after the process. Means this Agni Karma, after the procedure, we will take the local site as a Vrana only, because we are creating a Vrana, right?
Yes,
So,
ma'am.
according to those descriptions given in Vrana chapter, same things can be adopted in this patient also, because after Agni Karma, the patient have developed a Vrana. So, there in Vrana chapter, it is told that the substances like the takra, means all this will cause vidagdha avastha, that will cause uh, production of pus. Those substances are like they will increase the production of pus. So it is told like we have to avoid the substances like the takra, etc. That is told in the note. That is separately told. As such, there is no direct mentioning of that patya patya. But when we consider that Agni Karma Krita Vrana as a Vrana as such, we can take the Patyavatya mentioned for Vrana separately. So whatever Patyavatya is told for Vrana, that same can be applicable here also. That's why that the Ditakra etc. are mentioned. As such, in Agni Karma chapter, it is not told about Patyavatya. Only thing is we have to give Pichilana for conditions other than Mudagarbha, Ashmiri, Udara, etc. That is only mentioned about this Agni Karma, but means diet. Other than that, direct explanation is not given regarding Patya and Apatya.
Ma'am, Itartha Dagga ಅಂತಂದು
Ittarada Dagda means in we have seen that Ushna and means Ruksha and Snigdha Dagda, right? So in the chapter it is like other than this Dagdas we have told like Tok Dagda, Mamsa Dagda. Other than that, another shloka is told like Snigdham Ruksha based on the dravyas used. There is another that is already we have told in the classification portion. That is there is another classification regarding the drugs used, that is Snigdha and Ruksha. Same is given under the heading Itarada Dagda. Itarada Dagda means something else which is told that when you see the chapter Agni Karma Vidhi, you can see that there is mentioning of that sloka. Tatra Snigdham Ruksham va cha ashritya dravyam agnir dahati agni sandapto hi sneha sukshma siranusarita. That there it is told like Snigdha dravyas when we are using for Agni Karma, that will uh, cross through the Sukshma siras. Because of that quality of that Snigdha dravyas, it will enter into Sukshma siras. That minute vessels or minute structures also will be afflicted, means will be affected by this Snigdha Agni Karma, and hence that Sneha Dagda will be having severe pain. Such a description is given in the text. So you have to understand that Idarada Dagda is Snigdha and Ruksha Dagda.
Yes, ma'am. And ma'am, when some usually karmas Agni or Shvedana is Samyak Agni Karma. ma'am. So how to know when to stop the Agni Karma procedure when starting?
Means practically you are asking.
Yes, ma'am. I don't.
Okay, fine. If needed, I will try to give the videos. Okay, if you have not seen, I will try to give the videos. But the thing is, mainly we will means according to the means mostly when we practice and all, we will see that it will not be that much deep. And according to the we should not go for that much adidagda avastha.
Hmm.
Okay.
Yes.
While applying that itself, we will get to know. Means by practical application only, we will come to know how much deep it is, how it can be done, and all. But if possible, I will try to find out video and will show you. Okay.
Usually,
We
ma'am,
have
when
to take.
pain and swelling, depending upon the degree, ma'am. So, when to stop degree and how much that one I'm saying, ma'am.
You mean when to stop?
When
We means while we do only, we will understand that how the means depending on the condition, we will select the site. Depending on the severity of pain and all, we will decide. Means if it have to be Tokdekda, while doing the procedure, we will get to know how much deep it should be. Then we will be having an idea on how much deep it should be. And if in case of severe and based on the shalaka used, I have told you different types of shalaka is being used. So based on that shalaka also, we can assess the depth by seeing only. Mostly we can, means it should not be that deep. Means the heat also, there is a particular time for the sustaining of that heat. So that also we will see, and practically while doing, we will assess that like that. As such, we cannot tell that the timing, or we cannot tell as such.
we stop, ma'am, when usually the shalaka will be hot, ma'am. That time
Yeah.
you
So
put
means it will be
that
red
area.
hot. Means if we are too much pressurizing and all, that will cause deep burns. So it is according to the condition. Sometimes we will just pinpoint. In some cases, that is only needed. In certain cases, we will not wait for that red hot appearance. And after keeping the shalaka, we will be uh, heating the shalaka. Right after, we will once we will mark the place, mark the point where there is maximum tenderness, then we will uh, point that shalaka. And after keeping the shalaka, we will burn the shalaka so that the heat is transmitted through the shalaka. That is also another procedure. So it is one thing is based on the tolerance of the patient. Some patient will not tolerate even minimum pain, means minimum heat. Such cases also, there is difference based on the heat tolerating capacity. Also there is difference in the time period and all. So different procedures are advocated for the same. Depends on that. And if it is red hot shalaka, and if we are keeping for so much of time, one thing is the patient will not sustain that heat. Second thing is it will cause adverse effects. So accordingly, we will decide.
Ma'am, when the patient not tolerate the pain, ma'am, you can postpone the day also, ma'am, to the next day.
Sometimes we will do, means in some cases we will see, in certain cases like lower back pain also, and all, immediate relief is obtained. That is, once we apply that Agni Karma, when the Agni Karma procedure is almost done, the same after, just after the application itself, we will find relief. In such cases, or in cases like uh, when we feel like the adequate procedure is not done, sometimes we will keep at the same day. And if morning it is done, we will keep another sitting for in the evening also. Such in such way also we will keep the procedure. And in other cases, we will try to do once in a week, or with a 2 days gap, we will repeat the procedure.
Okay, ma'am. Ma'am, Ishar, you say, ma'am, in horizontal way.
Yeah,
Ma'am, how to insert the instrument and how to the treatment, ma'am, not
that is
understand.
Ischirotomy. Means the thing is that will be a thick layer is formed. That is a scab, like uh, thick layer is formed over the burnt surface. So because of that, we, means normally if there is fluid accumulation and all, it should be removed, or it should find a way out. So that will not be happening due to the thickness of the skin over the surface. So for that, over that area, we will, normally it will not happen. So surgically, we will be keeping incisions in that. I will tell. See here. So in this image, it is told different regions are told, right? Certain regions are marked. See in the upper lip, in the chest region, how it is. Means that markings is the how to perform the ischiotomies. So as I have told, ischar is something which is it's contracted dermis. There will be thickening. So from there will not be means removal of that fluid will not happen. So there will be accumulation of fluid, and inside edema will happen. Edematous fluid will be there, and when this fluid accumulation happens, there will be compression and compression to the adjacent structures, and this compression will lead to ischemia, gangrene of other parts. So that's why we go for ischiotomies. So if we are not doing that, and if inside that fluid accumulation is happening, there will be complications. And so to remove that fluid, or to remove that to prevent that collection of edema fluid, we are doing deep longitudinal incision, full thickness incision. That is, full thickness incision means we have to go deep till that accumulation level. So where the accumulation of fluid is happening, that much depth, longitudinal full thickness incision have to be done. The parts we have told, means you can see the markings, means how much longitudinal means how much it is done. It should not be zigzag, because when ischiotomy is done, there will be chance of injury to other structures, nearby structures. So we are telling that with proper care, longitudinal incisions are done by making sure that there is no injury to, means avoiding the injury to major nerves and vessels of the region. We should do deep incisions so that we will remove the collected fluid inside, and thereby we can prevent the compression of the vessels. And during ischiotomy, there will be large quantity of blood loss also. So we have to, means that much deep incision we are doing, and that too a longitudinal lengthy incision. So we have to make sure that the blood loss which is happening during ischiotomy, that is maintained by blood transfusion. And always the incision should be of adequate length and depth, because we have to make sure that the purpose is served. We have to remove the fluid, so it should be of adequate length and depth according to the Ishar form. Means it may vary. We cannot tell that in all places, in all patients, in all burns, the same thing will be happening. So based on that, the incision have to be decided. In cases if needed over the joints and all, multiple incisions are also advised. Okay. In some cases, the Ishar itself is removed. That Ishar can be that thick portion will be excised, and skin grafting, etc., will be done. That depends on the condition. That is about ischiotomy.
Ma'am, rule 9 once again. To tell.
Rule of 9 means that is the method of assessment actually. So the percentage, as I have told, in the treatment portion also, when we see, it is important to assess the burn, means how much percentage or how much area is affected, that we have to know. Then only we can treat the condition properly, because based on the percentage of burn involved, all those things, we will assess the condition of the patient. Accordingly only treatment can be done. So for assessing the burn, this rule of 9 is true. Rule of 9, it is given the name because in this picture you can see the anterior and posterior aspect is taken. So first is head region. Head region, then head and neck region. The first in the picture you can see the head and neck region is taken, and it is told like the head and neck region totally it is 9%. That is when the burn is happening in the head and neck region, If it is in the anterior aspect, it is 4.5 percentage. If it is in the posterior aspect, it is 4.5 percentage. So when the burn is happening in the head and neck, it is given 9%. Then if there is burn in the front of the chest wall and the abdominal wall, again 9 and 9. Chest wall it is 9, abdominal wall it is 9. So when burn is happening in the chest wall, again 9 is added. Then if there is burn in the front of abdominal wall, again 9% is added. So now if there is burn in the head and neck, front of chest, front of abdominal wall, we have added 9 plus 9 plus 9. Then when we consider the posterior aspect, posterior back of chest and abdominal wall, similarly 9% is added. Then next is the lower limb. Lower limb, again it is 9 in one lower limb. Means first portion, means front portion 9, and then next lower limb total it is 18 into 2. The lower limb it is 18 into 2. 9 into 9 means 4 nines. One portion means upper portion and lower portion 9 9. Total it is 18. So there are 2 limbs. So it will be 18 into 2. So in the lower limb alone it is 36%. Upper limb as a whole it is taken as 9 into 2. That is 9 for one limb. Similarly, 2 limbs it will be 9 into 2, that is 18%. And the perineum region in the diagram it is shown, it is taken as 1%. So when we add these all the things together, we will get 100%. The total body surface area is taken as 100%, and accordingly the percentage is given. So when a burn is happening and when we are assessing the patient, according to the regions affected, according to this rule, the head and neck 9%, front of chest and abdominal wall 9 into 2 18%, back of chest and abdominal wall 9 into 2 18%, lower limb 18 into 2 36%, upper limb 9 into 2 18%, and perineum 1%. Totally it is 100%. Like that we can assess the percentage of burn in the patient. Is it clear?
Yes, ma'am. Ma'am, pathophysiology once, ma'am. That is enough.
Absolutely. Pathophysiology, as I have told, one thing is 3 zones, that is okay. In the major pathophysiology, we will see. First, I have told about that superficial and deep burns, right? So, superficial burn, when you see the left side, superficial burn is happening, and then there will be damage to the keratinocytes, the cells present over the superficial surface of the skin. There will be damage, and in turn, as there is damage, the immune response will be activated, and there will be the cells like mast cells and all those immune related cells will get activated, and that will in turn cause the production of certain cytokines. These release of substances that will lead to certain symptoms, or that will cause some changes inside, and some symptoms will be appearing. So these cytokines, the means so much of substances are released, and some cytokines will act on the nerve endings. Nerve endings means it will cause the pain sensation. When the cytokines act on, or it stimulate the nerve endings, it will cause pain. Next it will increase the vascular permeability. That is, when the vascular permeability is increased, the fluid shift will be increased. That from the inside of the vessels, the fluid will be shifting, and that will cause in the spaces and all fluid accumulation will happen, and that will cause edema and all. Similarly, when the fluid is moved upwards, there will be blister formation. When the fluid accumulates in a particular region, there will be blister formation also. So that is another symptom. Similarly, these cytokines will act on the blood vessels, and it causes vasodilation. And that will further lead to symptoms like warmness, blanching, erythema. All those symptoms will be caused due to those changes happening inside. That is what is happening in superficial burns. And when in deep burns, what is happening is directly there is destruction of the blood vessels. And in superficial burns, due to the action of cytokines, this is happening. So here in deep burns, it is like due to the deep burn, directly there is destruction of the blood vessels. And because of that, almost same features, but there is no moist appearance will not be there. So that is what is happening in superficial and deep burns. Is it clear till that? Or was there any break during that? Should I
Wait,
repeat?
it's okay, ma'am. I will check.
Allah, it's okay. If you have means where means still what portion you have heard?
Ma'am, vasodilatation, ma'am. That I can.
Okay, superficial burn. Okay, that is what is due to that release of cytokines as it acts on different areas. Means when it acts on the nerve endings, it will cause pain. When it acts on the permeability of the vessels, when it increases the vascular permeability, there will be fluid shift, and in turn there will be edema, hypotension, and all. And these cytokines will directly act on the vessels and cause vasodilation, which in turn causes warmth and etc. over the surface of the
There is
bond
break in your
region.
voice.
That
Hello?
is what is happening in superficial burn. And in deep burn, that is like directly there is destruction. Hello? Now is it clear?
Now it's okay. It's just before that, there is some break.
Breaking?
Yeah.
Okay.
Now it's okay. You can continue.
So that is next is about the deep. In the case of deep burns, it is direct destruction of the blood vessels, and almost same things except few changes, like it will be dry, it will be inelastic. All those features will be present in deep burns. So in pathophysiology, the heat causes coagulation, necrosis of skin and subcutaneous tissue, as told in the definition. And like I have told, there is release of certain substances which increases the or which alters the capillary permeability. And because of this altered capillary permeability, there will be loss of fluid from the vessels, which causes severe hypovolemia. That is, there will be loss of fluid, which results in the severe reduction in the fluid amount in total. That is severe hypovolemia. And this hypovolemia will in turn act on different systems like cardiac, renal systems, etc. Like decreased cardiac output, decreased renal blood flow, etc. So further, because of this, multiple systems are affected. Similarly, if there is infection and all, that also can affect different systems. And if this infection again lead to sepsis, septic shock, etc., that will be a condition of multi-organ dysfunction syndrome, and eventually there can be death also. That is the pathophysiology.